Well, the new Limpopo Liquor Act comes into effect today. The controversial act prohibits the sale of alcohol after midnight, and it's all in an effort to curb crime and other social ills, including gender-based violence. Now, several liquor traders, including the National Liquor Traders Organization, have criticized the act and have asked the Economic Development, Environment and Tourism Department to review it. One department that's welcomed the change is the Health Department. The MEC in the province, Phophi Ramathuba, joins us this morning. Dr. Ramathuba, it's great to talk to you. Thanks very much indeed for coming on to the AM report. So there's that segment of liquor traders that says taverns are being scapegoated for fueling crime in the province. What's your response to that?
Morning, Michelle, and morning to all your viewers out there, and thank you very much for inviting us. And maybe just to give a background, if I remember, it was as early as 2009 when the Limpopo legislature had public hearings. I remember at that time I was one of the shop stewards who attended those public hearings about this particular Liquor Act. It's not something that is coming today. The Department of Economic Development is just now at a stage of implementing what has now become the law within the Limpopo legislature. Now, one of the reasons that were raised by the Department of Health as really advocating for support of these amendments was even that time before we even had COVID. You could see that many accidents that happened, the raw data that one could have. I was a casualty officer at that time. And once it's 12 o'clock midnight, you know as a casualty officer, you must pack your blankets and go and sleep in casualty because the trauma, which are alcohol related, whether it's stab wounds, whether it's a gunshot, whether it's road accidents, fatalities that happened after midnight were alarming for us. And when we now look at the studies that have been done, prior COVID, even the national survey, which included Limpopo, was very clear that Limpopo is also one of those fatalities that are happening are as a result of alcohol. If you look at the studies that were done during the hard lockdown, and also what we did as a province, our forensic pathology department, the survey that they did, comparatively speaking, during 2020 hard lockdown months, similar months the following year when we were not under lockdown, there was no alcohol restriction, we have seen that the mortality rate jumped by more than 40%. So you can see that for us as a Department of Health, we want to be honest with you. We are one department that promotes job creation. We don't want job losses because they are also linked into social ills, which also put a burden on the health system. However, we cannot say because we are advocating for people to get employment, it must be at the cost of the current very same lives of our people. In summary, we have seen in terms of the health department that once we can have this restriction in terms of the trading hours, it will reduce the fatality, it will reduce the morbidity, the current orthopedics backlogs that last week were just at Skupuni. Majority of those cases who are waiting for orthopedics are road accidents. And what really happened most of the time, alcohol is being linked. And lastly, there is one of our forensic pathology registrar who is currently doing a study on the R71 for pedestrian, where on R71 road towards Mangwe, after midnight, we have a lot of pedestrians who succumb to road, they are being hit by the car, and that road, if you look at it, there are so many taverns on that particular road around to Wapaledi Mall. So the reason why she had to opt to do this particular study is because she has seen that most of the corpses that are collected at that time, some of them, majority of them, are alcohol intoxicated. They will leave the tavern at 2 in the morning being drunk, and there will be a car that is coming which they won't even see it because they are under influence of alcohol, and they will be hit by the car. So for us, ours remain that of saving lives and prolonging lives. Hence, we are one of the department who are saying this act is coming at the right time to reduce the burden of healthcare system as a result of trauma and road accidents.
Yeah, absolutely. So essentially what you're saying, MEC, and we've known this for some time, haven't we, that there is this inextricable link between the pressure on the healthcare system, the kind of violence we're seeing in communities, and the excessive consumption of alcohol. I suppose the question becomes, you know, is this midnight curfew going to do what it's intended to do to help stem these kinds of incidents in a context where we've all been at macro and we've seen how people buy alcohol in bulk?
We are saying once there is a legislation, then you empower police to can do the work. Currently, police cannot do anything even if they find you drinking at your tavern open at 1:30 a.m. And remember, when I look at the act, they are also, it's not about them losing all those hours, because in the past they used to open, I think it's around 10, now they've been allowed to open earlier on. Because where we are as the Department of Health, we're saying evidence is there that link the alcohol consumptions or activities that are involving taverns being open after midnight and the mortality and the trauma that we see. Our pathologists will tell you we pick up most of the bodies in the taverns after midnight. Hence I'm saying some of them have even decided to say, for now, let's do a proper study which will be peer-reviewed and published so that we don't speak about things that we have not yet tested. However, for someone to even come and decide to have a hypothesis to say, I want to prove it, it's because the evidence is already there. The raw data that I was even analyzing, which I was given by our pathologist, it shows that really there is that particular link. And the curfew has proven during the COVID-19 that it does work. We are not stopping people from drinking alcohol. We are just saying anything that is done without restriction, unfortunately, it will have its unintended consequences, which in this time, it's life that is lost, and life lost can never be regained again.
Dr. Phophi Ramathuba, the Limpopo Health MEC, let me thank you for your time this morning, Doc. The new Limpopo Liquor Act coming into effect today, and it is an act that liquor traders in the area are still fighting, saying that they can't afford this reduction in their trading hours. It's certainly a story we'll continue tracking for you here on 405.